Good morning. I was asked to perform the cardiovascular examination. This is my patient, my cousin, Shanin Giral, and acting as my patient for today and me as a doctor. So first, I would like to confirm if she really understands the video. This is just for academic purposes only, and I have here consent form in order to prove that she really signed the form to really understand it. So this is the consent form. So first, I will be taking of her JVP, or the jugular venous pulse. So the jugular venous pulse, it is best assessed in the internal jugular vein, directly lined with the superior vena cava and the right atrium. So what am I going to do is that I will ask the patient to lie down or in a supine position in order to properly locate the jugular venous pulse. So, good morning, ma'am. I will be examining for your heart today. So, allow me to introduce myself. I am Ami Giral, and I will be your doctor for today. So, ma'am, can you lie down for me? Make a supine position. So to properly locate the jugular venous pulse, so I will make sure that the patient is in the supine position and make her comfortable, and I will ask her to turn her left slightly on the left, because the right carotid, the internal jugular vein is best assessed in the right part. So, ma'am, can you turn your head slightly on the left? As you can see, it is not directly visible because it is covered by the sternocleidomastoid muscle. And after you can palpate the external jugular vein, rather, because internal jugular vein lies deep in the sternocleidomastoid muscle, look for the pulsations in the suprasternal notch. So suprasternal notch, it is located in the middle of the clavicular line, and also it is where the sternocleidomastoid meet. So it's over here. It's in the middle of the clavicle. And after you can palpate the pulsations in the suprasternal notch, move above, palpate it, the highest pulsations you can see. So it's over here. It's actually 5 centimeters when you measure it, the highest pulsations. So when you can get the 5 centimeters, make a right angle to your directly lower to your the right angle is directly lower to your suprasternal notch. So it's like for her I'd make the right angle. So for her, it's just 1.5 centimeters, because as you can see, she's just only not an adult. So I will add the 5 centimeters to 1.5 centimeters. It will result to the JVP, which is the 6.5 centimeters, which is normal. So it is important to distinguish the carotid pulse and the jugular venous pulse, because carotid artery is like, when you palpate it, you may palpate vibrations and thrills, especially the vibrations like cat purring. So when you palpate for the carotid pulse, you may palpate both sides, the left and the right. So just ask the patient to stop, like in some other sources, just ask the patient to stop breathing for 15 minutes, and using this diaphragm part of the stethoscope, you may auscultate it, because it's for the high pitch sound, so you can hear frequently the bruits. So left root and the right. So vibrations and thrills is caused by the arterial turbulent flow. So you can hear it because of that. So the next is the point of maximal impulse. So as you know, there are 4 chambers in the heart, but the point maximal impulse, we're focusing on the left ventricle. So the left ventricle, as you can see, if this is the heart, palpate the left ventricle, and the left ventricle, there's the tapered tip in the heart, which is clinically important to locate because it is where your apical impulse will be located. So apical impulse, it is in the mid-clavicular line. So when you say mid-clavicular line, this is the clavicle, it's in the middle, so it's below the it's directed to the mid-clavicular line, so over here. So, and to locate the sternum, it's in the left lateral to the mid-sternal line. It's actually 7 to 9 centimeters from the mid-sternal line. So mid-sternal line, mid-clavicular line, 7 to 9 centimeters, and below is the mid-clavicular line. So the apical impulse is clinically important to locate because it is where your apical impulse, which is guide you to the point of maximal impulse. So it's in the left lateral margin of the heart. So it's over here when you palpate it. So the next thing I will do is that I will identify the 4 heart sounds by auscultating it. So I begin with the S1. Auscultate the heart sounds at various sites. So at the apex, at the base, where the base is like it's the middle of the apex and the sternum, and in the aortic or pulmonary areas to the right and to the left, respectively. Listen to the heart sound. So the first heart sound is the S1 or the lub. So as you can see, you know, the heart will sounds like the lub dub. So the lub is the S1. So it marks as the beginning of the systole. So related to the closure of the mitral valves and the tricuspid valves, so it is loudest at the apex. So I will show the apex a while ago. So apex is apex of the heart is over here in the left ventricle. So this is where your S1 can be heard. The second heart sound, the dub, marks the end of the systole, or the beginning of the end of the systole or the beginning of the diastole. It is related to the closure of the aortic and pulmonic valve. It is located, you can best hear it in the base of the heart. So at the base of the heart, it's actually right side of the apex. So if this, you can hear this in the apex in the first heart sound. The second heart sound is the base of the heart. So it's technically below the mid-sternal line. So the third and the fourth heart sounds are abnormal heart sounds. You can't really hear it from the normal patient, just like Pachanili, but I just wanna define it. So the third heart sound is also known as the ventricular gallop. It occurs just after the S2 when the mitral valve opens, allowing the passive filling of the left ventricle, allowing the left ventricle. So S3 will be loud enough to auscultated. S3 is sound heard best at the cardiac apex, so it's the left ventricle. To best hear the S3, the patient should be in the left lateral decubitus position. And then after the S3 is the S4 or the fourth heart sounds. The fourth heart sounds is also known as the atreo gallop. So it occurs before the S1 when the atria contract to force the blood into the left ventricle. So like the S3, S4 is low pitch, so it's low pitch and best heard in the apex with the patient in the left lateral decubitus position. The next is the pulses. I will start in the brachial pulse. So brachial pulse, the brachial pulse is located by feeling the tendon, the bicep tendon in the area of the antecubital fossa. So here, I will show you. This is the antecubital fossa area. So move the pads 2 to 3 centimeters. Tendon in the fingers below about 2 centimeters from the tendon and about 2 to 3 centimeters above the antecubital fossa to locate the pulse. So it's over here. It's the pulse nearest to your body. So it is usually measured when you take blood pressure measured. It's the best pulse you can measure. So it's like here, your brachial pulse. And then after the brachial pulse, I proceed to the radial and ulnar pulse. So radial or ulnar pulse, it is found in your wrist. So it's over here. I will begin first in the radial pulse. So it is taken over the area where the thumb site. So if this is the thumb site, so this is where your radial pulse wrist, while the ulnar pulse is taken on the other side of the wrist. So on the other side, this one. So both pulses are taken on the palm side. The radial artery is normally preferred over the ulnar artery because radial artery is pulse is somewhat bigger than the ulnar artery. And after the next one is the femoral pulse. So below the inguinal ligament and about the midway between the symphysis pubis and the anterior iliac spine is your femoral pulse. So the next is the popliteal pulse. It's the popliteal pulse. It's the point comes from the femoral artery, and you will find this pulse on the back of the knee. So can you stand and turn back? So the popliteal pulse is the back of your knee. So it's like here. So it is hardly to be palpated, so you should palpate it deeply. And the last one is the dorsalis pedis pulse. So, ma'am, can you lie down again? So, dorsalis pedis pulse. The dorsalis pedis pulse is palpable in the dorsum of the foot. So, dorsum of the foot, it's like in here. The first foot in the first intermetatarsal space, just lateral to the extensor tendon of the great toe. So done with the pulses. The next, after the pulsations, you should inspect the skin ankles and the feet for color. So it should be pinkish, and the temperature, it should be not above 37 degrees Celsius or not too cold, and also the skin integrity, the hair loss, and the nail pathology. So, ma'am, we're done. Thank you for today.